Hi, I'm Richard Weaver, GP Director and Head of School for General Practice.
And I'm Toby Pitstucker, one of the F2 doctors at Bournemouth Hospital.
I gather you're just coming to the end of your placement in General Practice?
That's right, yeah.
And how's it been?
It's been really good, actually. Yeah, I've really enjoyed it, thanks. Yeah.
Okay, and from this placement, what things did you gain and like to pass on to the other people?
I think, what have I gained from doing this placement? Well, it's been a very varied placement. It's really introduced me to different aspects of care that you don't really see in secondary care so much. It's given me a huge amount of opportunity to get feedback from my GP trainer on individual consultations, developing time management skills when you're having to see patients quickly. Albeit we're not expected to see patients every 10 minutes like GPs are, but we gain an appreciation of what that must be like.
How was the feedback handled and how did they do that in the practice?
Well, the first couple of weeks in my practice in Verwood, I was supervised very closely, and I got to see how some of the GPs worked and sat in some of their consultations.
So you saw lots of different doctors. Do you see other team members as well?
Yeah, so I went with the tracker nurse for a day to spend with them, as well as spending some time in the pharmacy nearby, just seeing how it all fitted together, and then, as I say, sort of getting to see how different doctors led their consultations, and then starting to lead my own ones with some feedback on each one from a trainer, and then gradually I'd start to do my own consultations.
So they were giving you tips on how to consult better and more quickly?
Yeah, exactly.
And was that good feedback that you got?
Yeah, no, it was really useful, I think, especially when you're not really familiar with how things work in general practice. It's kind of important to get that sort of established from the word go. Yeah.
And did you have individual teaching with the trainer?
Yeah, so I had every week had an hour's worth of a tutorial, which could be anything from talking about sort of ethical principles to discussing particular cases, or even sort of talking about career plans and so forth.
And was that led by yourself, or was it just a set curriculum?
It wasn't a set curriculum, it was sort of fluid, so we'd decide sort of on the day what we were going to do, really. But I understand that varies quite a lot with from practice to practice.
But very much based on what you'd identified as your learning needs?
Yeah, definitely. Yeah, no, it was very much tailored to that.
Yeah. So you had experience with other people. You mentioned the nursing and the pharmacist. What was that like?
So that was really interesting. Allowed me to go and visit people in their own homes, and understand a little bit about what other healthcare professionals do, really, and sort of piecing that all together so what resources are around and who you can sort of call on to help sort of with different aspects of patients management, and so that was really insightful, actually. Yeah.
And support-wise, did you feel you were supported the whole time?
Yeah, there was always someone in the building, who usually the duty doctor, who I could call on if my GP trainee wasn't there, and they were always very welcoming, and would always have time for you to sit down and talk about a patient, or even if you're really concerned to come and see the patient themselves as well.
And you did home visiting as well, you said? Yeah. Independently or with another member of the team?
Usually with another member of the team, but often I'd go on my own if it was a patient I knew, or if it was something that wasn't too serious.
Yeah. And generally, would you discuss the case before you went out with your trainer or education?
I'd usually discuss it before, and then I'd sort of report back and sort of have a think about what steps to be taken next. So yeah, usually I'd discuss it before and after.
Yeah. Having nearly completed your 4 months of placement, is there anything you'd actually like to say to people? If I was doing it again, I would like to add this in, do this sooner.
Well, I think I'd just say just look for the opportunities that are there, because general practice is incredibly varied. If you want to get involved in minor surgery, then you can do that. If you want to go and do some clinics in in for example, diabetic clinics or ENT clinics, then
Yeah.
often there's scope to do that. Or if you want to, if you're interested in the management side, then there's always that to explore as well. So I'd say just put yourself forward and see what really grabs you, I guess.
So did you have that discussion at the beginning with your trainer about what you wanted out of the placement?
Yeah, no, I had a chat with him about that, and we came up with a sort of plan. Yeah.
So it's a good idea to have some thoughts about what you want to do and experiences you want from the placement before you go, and to discuss it with the trainer.
Absolutely, yeah.
Okay, thank you very much.
Thank you.